It's good to be here. Thank you for having us. I'm going to cover a little bit about what Rise Vermont is for some of you that don't know. I'm going to talk a little bit how we're functioning right now as a group, and then I'm specifically going to tell you about how we're working with businesses and the model that we've set up that we can partner with you at your work sites. So I just want you to think about that as I'm giving my presentation so that you guys are thinking about how we can partner and integrate together. So go to hit it twice, I think. So Rise Vermont. So the vision, basically the whole Rise Vermont, our motto is embracing healthy lifestyles. That is really what we talk about all the time in every place of community is all about embracing healthy lifestyles. Recently, we have a new, well, maybe not recently, but a while now, we have a statewide board. Through Jill's leadership, Rise Vermont has been such a successful program locally. It's been around for about 2 years now. Jill has been able to bring it statewide. And more recently, within the last couple of months, we've actually hired 2 statewide people that are going to be joining our team to help other communities embrace healthy lifestyles with the Rise Vermont vehicle. But basically, the statewide Rise Vermont mission is Vermont will be recognized as the healthiest state in the nation, with healthy living being the norm. Okay, so next slide. Essentially, the way that we started, and I was actually part of the initial group, which is really interesting coming from my perspective. I was on the community committee for healthy lifestyles, and really what it was about was convening public and private partnerships to evaluate the health of our community. And we worked for 2 years before launching Rise Vermont. Jill would have us meet at 6:30 in the morning, pretty much. It was rough being on that committee. But we went through a whole process. Can you go to the next slide? With a community committee, there was about 30 people at that table, give or take, right? And Jill set that table and Jill in the health department set that table and invited community members to that table. And what we decided was that we really, I don't know why it's cutting off, but we really decided this red part is Franklin and Orleans County. And one of our biggest health indicators when we went through the health risk assessment of our community was really obesity. It rose, I think it's number 2 after opiates. And so we really decided as a community that that's what we wanted to come together and work on as the community on healthy lifestyles. And through that, so next slide, please. We developed a stairway speech to have consistent messaging for the whole community. And so Rise Vermont is a community collaborative to embrace healthy lifestyles, improve the quality of life, and lower healthcare costs where we live, work, play, and learn is the last word on that slide. And the learning is really how we intersect at schools, in the school systems. And so the next slide, please. So over the first 2 years, there was a lot of momentum built around getting our message out there. And we kind of blew our numbers out of the water in terms of the metrics that we set for ourselves and where we actually ended up. And so we have a lot, these slides basically show engagement. And at this point, a cool fact is we have over 10,000 likes on our Facebook page. So that's pretty big in the social media world. And a lot of those were organic and some of them were bot, but we have a lot of likes on that. The other thing is the number of businesses that we've been able to engage with. We're currently at about 46 businesses that we're working with pretty intentionally, and also the number of safe routes to school. So Safe Routes to School is a national program, and it's about getting children out and walking to school as opposed to getting on the bus or having their parents drop them off. And so I think we're working with about 10 or 12 schools at this point on the Safe Routes to School models. So next slide. So this is just a quick snapshot from our website in terms of who's already rising. And so we have almost 19,000 people. We have about 46 businesses. We're working very intentionally with about 16 schools in our school systems in Franklin and Grand Isle County, and 9 communities. And what we actually mean by communities are municipal governments. So working with the town of Swanton or the city of St. Albans or the town of St. Albans. So we're working with about 9 communities in that realm. Go ahead. Go one more. Mm-hmm. So I just want to quickly, and I'll go through this pretty quick, and there's a lot of information here, but it's really important to know like where we're centered and where we come from, because I think it sort of helps to explain our program to a lot of people. So if you can go to the next slide, there's this thing called the socio-ecological model, which is the Vermont prevention model. It's a health model that's used in a lot of different health interventions. And essentially, we adopted this model for the Rise Vermont program. And so we work at every level, but we know very, very quickly on that the individual will not make behavior change if they're not supported by the environment that they live in, right? And so what we really work on, and there's another slide that I'll show you in a minute, but what we really work on is these outer circles as well as the individual. And I kind of see it as a two-tiered step. You want individuals to be engaged so that they're asking for public policy change, so that they can then influence the systems that are surrounding them. And then where you guys as businesses come in is sort of this organizational circle, and also where we do a lot of our work within the school system as well as in the business community. Because if they're going into an environment, if employees are going into an environment or children are going into an environment that doesn't support healthy lifestyles, then that's where the individual's intentions for living a healthy lifestyle start to break down. So go ahead, next slide. So that's what that's supposed to explain. The other thing that we did, and we worked very closely with the Vermont Department of Health and Judy Ashley. I actually have somebody on the Rise Vermont team who is the chronic disease nurse for the health department, and she works with us on a one-on-one basis. She's part of the Rise Vermont team. And so we've rooted all of our strategies in the CDC best practices. So the Centers for Disease Control have a whole range of tools that we can utilize on their community prevention and primary prevention models that we utilize, including the scorecard, which I'll talk to you about in just a minute. So next slide. Actually, it's right here. So one of the things that was adopted really early on with the Rise Vermont team was the scorecard. And the scorecard is something that we can come in and help evaluate your business, and what I'm sort of calling a gap analysis of your wellness and what you intend your wellness plans to be and what they actually might be, and how your employees might be either supported in that environment or not. And the scorecard is really that strategy that we use, when we enter into a business. Jessica's done this quite a bit actually at this point. When we enter into a business, we go through that scorecard with you and figure out where you fit and what your goals are as a company to support your employees in their wellness journeys. Next one. This one's going to be really quick. But EPOD International surfaced during this whole time that we were meeting when we were meeting as a community collaborative. And EPOD International is from France. It actually means Together We Reduce Childhood Obesity. So that's what the acronym means in French, and I could say it, but I don't want to shame anybody. So that's what this acronym means, and the EPOD methodology is how we do what we do. Next slide. So actually, and Elizabeth Fontaine, who's here with us today, Dr. Fontaine, was the one who was doing all of this research and trying to figure out like what were some of the strategies that were out there that were actually successful. And this strategy was highlighted by the U.S. Chamber of Commerce out of 100 different programs that are designed to reduce obesity rates in different countries. And at this point, go ahead to the next slide. This was the slide that has really captured everybody's imaginations. And I'll just quickly explain it, but they started with 2 communities in France. And if you can see the year, it's 1992 to 2000. The first 8 years that they were in this community, in these 2 communities, obesity rates didn't change. They were only working in the schools. They were only trying to influence the school system. In 2000, they started working directly in the community. So they started doing community-based interventions. They started working with families and work sites and municipalities, and that's when they started to see this change. And so you can see from 2000, 2004, the obesity rates in those two towns went down by 8%. And then the cool thing is that they've been able to replicate this in many different countries, and Rise Vermont being the first program in the United States of Vermont, or in the United States of Vermont. That's a thing, right? That could be a thing. The United States of Vermont. That could be the United States of America. And so right now, when we were evaluated by the EPOD program, you can go to the next slide, we scored 85% out of 100. And that was in 2016? 2015. We're really excited. They're coming back in February as we roll out the statewide Rise Vermont program. And so I don't know if they're going to reevaluate us or not and see where we're at, but we've taken some of their insight and applied it to our program. But essentially the 4 pillars of EPOD is what we follow. And again, I apologize if this is hard to read, but it's an integrated, coordinated, sustainable approach. Political commitment. And that is something that Jill is a master at. And she's working very hard to make sure that we get the political commitment for primary prevention in the state of Vermont. Resources, including public-private partnerships, which is where all of you come in to our program. Support services, including social marketing, which is where Rachel is helping to develop our social marketing. It's not just social media, it's social marketing. And then science, evidence-based, and evaluation. And this last year, we created under Elizabeth's leadership, Dr. Fontaine's leadership, a scientific advisory committee for the state. And that advisory committee is basically staffed, or who sits at the table? A lot of researchers from the University of Vermont team, as well as the health department, and Elizabeth is the chair of that. So it's been really nice to have that evidence-based scientific committee within our realm. Next slide, please. And this slide is very cool, if you can see it on a PowerPoint, but I was pressed for time. But essentially, quickly, the EPOD model, and I just want to just quickly mention, there's an EPOD central coordination team that includes the local project manager and then local elected officials. And then the really interesting thing is the steering committee. And on that steering committee sits municipalities and businesses and schools and local associations like the Rotary that are all part of this EPOD model and how we're structuring the Rise Vermont program. Next slide. Thank you, Jessica, by the way, for doing this.
You're welcome.
So, and just quickly, this is the map of where all the EPOD programs are at this point. And you'll see the U.S. on there, but it's about 46 member programs across 29 countries. And a couple of members of our leadership team were able, Wynn was one of them, to go to the Netherlands to see how the YOG program functions over there. And I've had the great privilege of being able to interact with some of those people on Skype to ask them questions about our coordinated campaign that we're about to launch in January. Next slide. So real quick, focusing our work in community, really where we focus is on the environment. So I want you to go to the next slide. We're going to go through these real quick. These are a little bit of snippets, but how we work with municipalities. So one of the things that we really noticed when we first started the RISE program is that there's great trails in Franklin County and great places to go outside, but nobody knows where they are, right? They're very hard to find. You have to know the guy that lives at the house that's near the trail to get directions. And so one of the things that we started working on really early on was installing signs, and putting signs up at our parks and our trailheads, just to let people know, hey, there's a public path here that you can use. We want you to use it. I mean, Hardack, it's right in my backyard. I go there all the time. There's so few people that use that resource, and part of it is that they just don't know that it's there or where they're going to go when they get there because there's no signage or wayfinding maps. So now they've got kiosks with a map with red lines on it. So Tim's getting there. He's just not quite there yet. He's on the Aldous Hill board. So I'm always like, so what's next? What are you doing next? But that's something that we really wanted to do. The complete streets design in Swanton is something that we worked on very closely with the village. And I don't know if anybody remembers, about 2 years ago we brought Mark Fenton here, who's somebody who will walk your community with you and help you figure out like how you can make it a more walkable, bikeable community. And we brought Mark to Swanton, and from there they launched the Complete Streets program. And now I don't know if you've noticed, but there's bike lanes in Swanton and new sidewalks, so it's very cool. And then the other thing is we're trying this year, our focus right now with municipalities is on policy. We're really hoping to advance about 20 new policies through different municipalities and towns. One last cool thing is Highgate has a sidewalk. So I don't know if people have driven through sidewalk recently. And I know the joke is it's the sidewalks to nowhere. My statement is it's the sidewalk to what's next. You know, where do you go from there, right? It's a beautiful little sidewalk. It connects the library and the municipality. What's next? We have a sidewalk to nowhere in front of the hospital now that goes to NCS. Actually, it goes to NCSS. It's not really nowhere. There is no sidewalk to nowhere. You know, and I sort of challenge the town. The sidewalk to what's next? What's next? Where are we going next from there, right? We got to start somewhere, even if it's small, even if it's a quarter mile, right? We got to start somewhere. Okay, so next one. Schools. So this is really my passion. I have 3 kids that are small and they're in school. They spend a lot of their time there. I'm always hearing about what's being served in the cafeteria and how they got recess taken away from them because their teacher's mean and all this other stuff, right? I mean, something happens, Duffy always comes home, Mommy, are teachers really allowed to take recess away? I'm like, well, they're not supposed to. Well, can you change that? So this is where we're really working very intentionally, is within the school systems. We work both at the administrative level as well as directly in the classrooms. I think SATEC had 7 classrooms go to bronze. So we have a scorecard system there, bronze, silver, gold, and SATEC had 7 classrooms go gold this fall. So go bronze this fall. So that's a really big deal. We have worked and partnered with Local Motion, and we have about 2. So Local Motion is the bike trailer that comes up here, and because of our partnership, they're prioritizing Franklin County and our schools and our camps. And so right now we have about 2,000 kids that are trained in bike safety, and then in addition to that, we've been able to give them helmets. So helmets are a really big deal for families. And then last, we just recently, and I was just at a training, we got a Voices for Healthy Kids from the American Heart Association. We just got a grant, about $30,000, to help school systems, I'm looking at Kevin, work on their wellness policies to upgrade those to make it better for the entire system in terms of wellness. Next slide. And then this is where I just want to talk really, and I'm going to get into a little bit more detail about the businesses. So a lot of you work at work sites. You have businesses. I've got about 5 more minutes left to go. And I know you all have to get back to work. But we are currently, and I'm going to tell you what our goals are for 2018, working with 46 businesses. And our goal is to get 90% of those businesses to move up in a scorecard level. We also want to work with you to get 50% of your employees to participate in wellness initiatives. Whatever it is. It could be you're going to do the Run for Gym this year and you're going to promote it at your company level. We want to help you get your employees to go to that run. Okay, so that's sort of our goal. And just very quickly, and I this is one of the things on our scorecard is making making work sites breastfeeding friendly. And this last year, I think we're at 50-something now businesses in St. Albans, Franklin County, have declared themselves breastfeeding friendly, which enabled Jessica to work with the city of St. Albans, so that now St. Albans is one of a few cities in the United States of America to be proclaimed a breastfeeding friendly city. So that's pretty cool. One of the things that we work on is with municipalities and getting their parks to be breastfeeding friendly, but also so businesses welcome breastfeeding friendly or breastfeeding mothers into their sites.
Are you done?
Yes. Okay. Next one. Sorry. Let's just skip, actually no, go quickly through this one. So the population indicators, you're not going to be able to read this, but essentially our biggest population indicator is that we want to change obesity rates in Franklin and Grand Island County. The state's at 25% obesity rate, obesity, we're at 30 right now, and that was over the last 2 years. It actually went up, not because of us, because we didn't even exist. This was in 2015 this data was taken, but we're at 30%. So our trend line is going the wrong way. Our goal with our program is to get that trend line to either stabilize or go down, and go down. And we know that that indicator is a really long-term indicator. The EPO chart, that was over a 15-year period. So that's what we're really, it's a long-term indicator. So what we've done is we've also broken it down into short-term indicators, which are based on some of the surveys that the health department does, and then including like eating more fruits and vegetables, moving less screen time. That's a really big one right now because screen time is going up and active leisure time is going down, which is one of our issues. Okay, so next slide. Our short-term indicators, I'm really going to just pull out this one. So go to the next slide. We have indicators for each one of our programs that we're running, but we want to work this year with 55 businesses. And by the end of 2018, our goal is to have 50% new fully implemented wellness policies in those businesses, and that each of our 55 businesses has 50% employee engaged in worksite wellness. And we defined engagement as an employee being part of at least one wellness initiative that you offer in your business. So it could be the run for gym, it could be the flu shot, it could be something that you do within your company, getting those people, getting your employees, helping your employees be part of the wellness movement. Okay, so next slide. And this is where I'm going to quickly go over. Brian, would you mind handing those out? How we partner with businesses. Oh, go back. Sorry. So how we partner with businesses. I just love this slide because I have deep roots in yoga, as does Jessica here. But we're not going to make you sit in a circle and do this. Unless you want to. Jill sometimes makes us do this. But what we want you to know is that we have the intention of the business at heart, and we want to work with you on whatever it is that your wellness pathway or your wellness journey is. Okay, so next slide. And how we do this, the first thing that we do is beautiful Jessica gets to come into your workspace and brings the scorecard with her and works with you through that scorecard to say, what could I be doing differently? What could we be doing better? What are your goals? And so that's where that gap analysis comes in. Like, what's happening now in your worksite for wellness and what could be happening that would be better, right? Okay, so next slide. So the question is, where do you fit in? And so we had to sort of break this down into two different categories. And the reason for that is because of size of business. And some businesses actually already have some really good programming through their insurance companies. If you're with Blue Cross Blue Shield, you should be tapping into the resources that they offer. So go ahead to the next slide. What we've done is we've broken it down into large businesses, 50 plus employees, and then under 50. And the first thing that we do, like I said, is Jessica and or Betsy if you're in Swanton, and or Stacy if you're in Enosburg, and or Renee if you're in Alberg, will come in and do a gap analysis of the wellness policies and initiatives. And then the other thing is we'll do a wellness program consultation and scorecard review. So we look at what's already happening. We actually kind of look at what your insurance might be offering. We've done this with NCSS, I think. We worked very closely with them. And then if you're 50 or more, we refer you into our lifestyle medicine department, corporate business offerings. So Vermont Precision Tools is one of the companies that we work with very closely through our lifestyle medicine department. And they've been able to do a ton of stuff for that company to help them make their wellness program more robust. Fresh Fruit Fridays, they do biometric screenings for their employees, they do health coaching for their employees. So there's a lot of offerings that the Lifestyle Medicine Department can bring to the larger employees in the region. And then if you're 50 or under, this is where Rise fits in. We do, again, the same thing, wellness program consultation and scorecard review and offerings. We'll provide support and ideas for wellness opportunities at work, the gap analysis. We'll do connections to local resources and referrals. And then the other thing that Jessica started in St. Albans is a small business umbrella. So what we realized when we were starting to go talk to these businesses, they might have 2-3 employees, not really enough to create a whole wellness policy around, or if you do a challenge, it's it might just be you. So, it might just, so every quarter now we have a meeting in St. Albans called the Small Business Umbrella, and any employer that has 50 or less employees is welcome to send somebody to that. It's a quarterly meeting, and at that meeting, there's really good food, so I just want to offer that. We eat really well at Rise Vermont. So we offer really good food, but we also will give you ideas. It's kind of emergent about what the community wants or what the businesses are looking for, but we'll look at different policy language that you might be able to adopt for your company. And then the other thing that we've done is we've offered challenges. We did a walking challenge like last year. Was that last year when I first started?
We're doing a veggie one right now.
A veggie, so Eat Your Veggies challenge right now with the Small Business Umbrella. And then the last thing is that we have an on-site, Brian could stand up now, Rise Vermont Health Coach. And that's what I want to talk to you about now. This is a free service, okay? We, early on in the program, I think Brian was the second employee for Rise Vermont after Dory, who I replaced. But it's a free service, and it's designed to work with individuals at their work sites. It facilitates healthy, sustainable behavior change. So a perfect example, we just are almost done our 3-year stint with the Village of Swanton. Yep. And Brian just went in and did biometric screenings, and everybody is maintaining. In the 3rd year, we do a biannual visit, and everybody that he went in and did the screening for has maintained their healthy habits. So I'm going to tell you a little bit more about that. The way that we structured this, and this was not my design, but it seems like it works, is the first year of the Rise Vermont Health Coach coming into your office, and it's a schedule that you set up with Brian. He does a recurring monthly site visit with whoever wants to come. I think we're doing it in the city right now. We did it in Swanton, Enosburg Village. So he's got a few sites right now that he's doing, and we're hoping to grow this program a little bit this year. But so it's recurring monthly site visits, and he'll do biometric screening and help you fill out your health risk assessment, which is an online tool that we have. It's the Cerner database. It's the same one that we as a hospital employees have all of our health information in. The second year, he'll come quarterly. So he'll come to your site quarterly. Again, a predetermined date. It's a recurring quarterly visit that he'll come in. And during that second year, he'll again do a biometric screening for the employees. And then the 3rd year, he comes in biannually. So he'll come in twice a year just to check in, make sure everybody's meeting their goals and happy with what's happening. And then during this goal setting session, so Brian is a Well Coaches certified coach. And during all of these, basically it's about your employees or yourselves establishing the goals that you want for your wellness lifestyle, right? And then he holds you accountable to those goals by visiting on a monthly basis. Did I explain that right, Brian? Anything you want to add?
No, the rest is on the flyer.
Okay, yeah, so we passed out a flyer about this program. We're really excited about it. We've seen really good results just by this template and how we've launched it out so far in the community. But this is where we're really interfacing with individuals, but we're doing it through the work sites. And so it's been really good. I think our next one that we're onboarding actually is museum volunteers. So we started working with Alex a little while ago, but he's the only employee. So he said, well, could we do our volunteers? Well, why not? So are there other places that we could be intersecting with individuals with this program is what we're asking. And I think that's it. Is that my last slide? That is my last slide. And it's exactly 1:10. Sorry.
Denise, thank you so much.